My name is Heather Lewis. I work at the Mental Health Foundation. I manage various projects, particularly with children and young people, a lot of which are through sport. So, working with sporting organisations to equip them and cheerlead and support them as they help to support people's mental health. So, the Mental Health Foundation has been around since 1949, and prevention is at the heart of what we do. And we help to support good mental health with a public mental health approach. So finding solutions and particularly wanting to support those who are most at risk of poor mental health.
What interested you in football and rugby, and in particular, what inspired you to find out more about sports and improving the conditions for other athletes in order to help them to thrive and form well?
So I have grown up enjoying sport my whole life, watching it and playing it, and knew that it was good for my own mental health to be active, to be socially connected with others, and to enjoy all the benefits of sport. However, when I then started working and volunteering in professional sport, I saw the pressures that can come to athletes and staff within elite professional sport because of needing to win and needing to perform. And so I wanted to upskill myself and equip myself more to understand what those pressures were and what then supported better and good mental health in those environments. And so I guess for me now, I do that in a couple of different ways. That's through research that I've done in and around mental health in a Rugby World Cup environment, and then also through my work at the Mental Health Foundation. So at the Mental Health Foundation, everything we do is evidence-based, and we want to make sure that we're working with sporting communities to help them be equipped to know how best to support people's mental health in those contexts.
What are the signs and symptoms of the mental health when you go to different sporting events and when you see day-to-day life person and your clients?
We do a lot of work with brilliant organizations who are working with children and young people and adults, and they get to know them and get to know how they're feeling, and they get to see what they're excited about, but also what some of the challenges are. And so they would get to notice when perhaps a children or a young person has low mood, when they're struggling a little bit with how they're feeling. And so we help them to know how to develop good relationships with those people, and to create safe spaces where they can talk about their emotions, and then to support them to try and find the right organizations or information to support them to deal with when they have poor mental health. That could be like signposting them to the GP, to the doctor to get help. It could be sitting and listening and providing a fun, safe space. That can sometimes be the very thing that someone needs, as simple as that.
What was your first career choice before you entered the sports industry?
I am a youth worker. That's what I did my first career in. So working with children and young people from the ages of 11 through to 25, helping them to flourish and to thrive and to gain the skills they need to be independent.
Can you describe any scenarios that people are visiting you with to help them cope with their circumstances?
I think a lot of what we see at the moment is people struggling with the cost of living, struggling with what's going on in the world, where a lot of our systems and services are busy. And so to come and to play sport for an hour and to have a place where they can be themselves, meet other people, have some fun, have exercise, be in the fresh air, that's a really good space for them. So being able to provide that space, which is the best that it can be, where people care and listen and want to support them, that's really, really important in the situation we find ourselves in the UK right now. We support the community aspects of the game. So we work with all different kinds of rugby and football community teams to support them, to train them and help them as they work with children and families and young people in the community.
What can be done to manage these experiences of any mental health problems that people are going through?
Yeah, so we have at the Mental Health Foundation our evidence-based top tips to help with good mental health and prevent poor mental health. That can be things from being outside in nature, exercising, being connected with other people around you, having people that you can trust to talk to about your emotions and your feelings. And then when somebody's really experiencing poor mental health, to make sure that they access the services around them. So that can be going to the GP and being signposted to organisations that can give specialist mental health support when that's needed as well.
During lockdown, when we had lockdown, and there must have been quite barriers and challenges, and now we're out of it. What do you think was the challenging time then and now?
So during the lockdown, we carried out research into how the pandemic and the lockdown was impacting people, and social isolation, being kept away from other people, that was a real challenge to people's mental health. So now that we are able to see each other more responsibly and appropriately, for most people, that's their experience. That can be a hard transition to make. And so working with people at their own pace, making sure that they're connecting in the way that's best for them. And we've also noticed that since the pandemic, with all the impact of the cost of living, research that we've carried out has shown that people have less money to be able to sometimes spend time with people and to have those opportunities. And so we would love for the systems around us to change, for the government to support that cost of living crisis.
Heather Lewis manages various projects among the youth in children. Heather also supports and advocates for those people who are involved in playing their role in sport, as they support people through mental health. Prevention is at the heart of what the Mental Health Foundation does, and they have been established since 1949. The Mental Health Foundation finds solutions towards assisting young adults to get through their mental health problems. The Mental Health Foundation finds solutions towards assisting young adults to get through their mental health problems. At the Mental Health Foundation, their work is all evidence-based. Heather has worked with many young people and supported them when they are going through adverse circumstances. They can help in many different ways, including signposting people towards a doctor and doing the best they can to help support people, making sure that they are working closely with people who are involved in sports communities to support them with poor mental health. Mental Health Foundation supports people who are going through poor mental health, and they sit down with individuals to help them cope with their issues and assist them with a provisional safe space to talk to someone. They can help people by making sure that they are consulting specialist help and ensuring that they are receiving the appropriate help from the relevant specialists. What are the close connections between sports and mental health, sound mental health?
Yeah, so we know that sport can be really good for mental health. So people being able to access sport. So people have all kinds of different needs, both physically and emotionally and mentally. And the more we can remove those barriers so everybody has access to sport is really important. And then for elite and professional people, making sure that where sport is a challenge for their mental health, that they're listened to and heard with that, and that they're able to find other ways to support good mental health. So for an elite rugby player, there might be times where rugby is not the best thing for their mental health, but walking the dog, going for a swim, maybe playing golf, that sport is good for their mental health whilst they do rugby as their performance career.
So what are the in terms of who you've worked with in the community teams, and what do you advise them to take away with them from your meetings with them?
So a big part of what we do in our meetings and in our trainings is talk about how important relationships are, how we can make sure that we treat each other well, value each other well, and provide spaces where people are able to be themselves, to be heard and to be listened to and to be encouraged. And the more that we can do that for one another, the more we can help to support good mental health.
What best advice would you give to someone that had mental health or well-being? Best 3 tips that you would give to them to release and have less mental health and have less stress on them?
Yeah, so we all have mental health, just like we all have physical health. And sometimes there are challenges which can lead to poor mental health. And so some of the top tips that can help with good mental health are, firstly, finding someone we can talk to who we can trust. That could be a friend or a colleague or a neighbor, a family member, or if we need to go and talk to someone like the GP or a professional helpline. Secondly, to do something we enjoy, whether that's making ourselves a cup of tea, going outside in nature, a TV show that we like, something that we enjoy can help to support good mental health. And thirdly, being outside and being connected to other people. So making sure that we have people around us who we can engage with, that can really support good mental health too.
What general advice would you give to anyone who is working outside of the sports spectrum, and if they're going through any kind of trauma, to clear their thought process and move forward? How would you advise them?
Yeah, I think it's the same advice, really. It's making sure that we're able to recognize our own emotions and how we're feeling, to make sure that we have a place where we can go and talk about those feelings to get the help that we need. As I said, that could be a friend or a family member, someone in your school, somebody in your workplace, or the GP. And then trying to, as much as you can, sometimes it's really hard, but trying to do those top tips that do support good mental health by being outside, by exercising, by connecting with other people, by taking care of ourselves.
After carrying out some research during lockdown, they concluded that more people were affected by lockdown and being socially inactive for so long. Social isolation was a real challenge for people's mental health. Research has shown that when people have insufficient funds, that can affect them profoundly. People usually have less time to spend with their family members due to the busy lifestyle. Top tips include enjoying things you like to do and spending time with families to communicate with can enhance your mental health. Being around people outside and making good, sound social connections. Discovering ways of how to access more opportunities to access sports as an outlet for people to connect with their communities, removing people's barriers of emotions and social barriers to help them access more support facilitated events. They want people's voices to be heard by experts who are best equipped to resolve their mental health issues. The Mental Health Foundation has been working amongst the government teams and departments to ensure that there is cost of living in place, ensuring that people are listened to and spending their leisure time more effectively, having solutions in place like providing people with a space to talk to someone and discovering perfect resolution.
Going forward in the future with your organization, I know you've seen a lot of things being changed while you've been there as well. Going forward, what plans and events have you got up and coming, and what have you got plans for the future?
Yeah, so the Mental Health Foundation is the home of Mental Health Awareness Week each year in May. And so in May, we will have our mental health awareness campaign, and we will set the theme for that and launch it. And we'll make sure that it's evidence-based, that it's going to help to support good mental health all across the UK. And so that's a really brilliant week that we look forward to each year. We have a website, which is www.mentalhealth.org.uk. And we have various social media channels, which you can find from our website too. And we don't provide particular helplines as such. There's other brilliant organisations that do that. We work a lot through our research and our evidence base and through partnering with organisations. In relation to people having different needs, something that we're really passionate about at the Mental Health Foundation is trying to support people, particularly those who might have more poor mental health. And so part of our work is about trying to break down those barriers through our policy work with the government and through our research, listening to people's lived experience. So therefore, the advice and the resources that we provide really are suitable for different people's needs.
And what's your plans for the future going forward? You've been in this organization, and what have you got for yourself planned in the future for yourself?
Yeah, so here at the Mental Health Foundation, we're really excited about the work that we're doing with sporting organisations, cheerleading and encouraging and equipping them. So growing that work across the UK is really exciting. And then for me, with my research with elite rugby players, is to continue to use that research and to try and inform better practices and policies throughout professional rugby.
And do you have any figures or facts about how many people daily normally have struggled with mental health or are getting mental health at the minute?
Yeah, so we carried out some research across, we do that each year for Mental Health Awareness Week. And for this year, we were looking particularly around anxiety and the impact of that. And we've seen actually that for 1 in 3 adults, so 30% of adults in the UK, they're really struggling with poorer sleep at the moment because of concerns about finances. And also we've seen that with young people, they are struggling as well with their mental health. And 45% of them have said that they felt ashamed to talk about their anxiety to anyone. And we know that young people are more likely to feel anxious than any other age group right now. Yeah, we would love to encourage everybody to be able to talk about their mental health when it's good and also when it's poor, so that they can get the right help that they need. But everybody's different and the way they communicate is different. So that might be by using an anonymous helpline or a text service or talking to someone that they trust. But we would love for the stigma of poor mental health to be really tackled and for people to be able to talk about it.
Mental Health Awareness Week is coming up in May next year, and there's a theme on every occasion. Mental Health Foundation helps people through face-to-face interactions and by signposting people towards specialist support. As far as Heather's future is concerned, she wants to continue with proceeding the research work. Statistical evidence suggests that more young people are more susceptible to feeling anxiety. Mental Health Foundation wants more people to communicate to enhance the condition of their mental health.
Our website is www.mentalhealth.org.uk. That's our website that you can contact us, and then our contact details are also available on the website too, info@mentalhealth.org.uk.